That's fantastic because um, neuropathy is something I never really heard about 20 years ago. But my goodness, I mean, I'm hearing people with neuropathy on a weekly basis, a lot of people with neuropathy.
You
And
know, I'm glad you bring it up again because this is not a neuropathy podcast, but there's so many people listening probably that know somebody with neuropathy if it's not themselves. I mean,
right,
everybody's got them in the family, and people do not understand. The patients do not understand, and most doctors have no idea either. But it's so simple, Sean, because and I'll explain it because I think this is great. I always love to explain this to patients. So where does neuropathy come from and what is it? And if we understand it, then we also know how to fix it. That's usually how it is, right? So from the elbows down and from the knees down, we have what we call, all of us, neuropathy or not, all humans, we have small diameter nerve fibers, okay? Now, in neuropathy patients, those small diameter nerve fibers, they are attacked, they are killed off. And so as time goes by, they have less and less of those fibers, which results in pain, burning, numbness, etc. And that then devolves in balance issues and difficult gait. So now they need a cane, they need a walker, they need a wheelchair. It's a progressive thing. Why
mhm,
is that? So let's talk about those nerve fibers. These nerve fibers, they give our brain feedback when we walk. It's called proprioception or kinesthetic sense. It's proprioception. When you and I walk, Sean, we're not looking at the floor or where we're walking. We plant our foot. There's feedback to the brain. If we feel it's uneven, then our brain tells us, look down, don't fall, adjust your gait. It's an automatic process.
mhm,
The feedback comes from the small diameter nerve fibers. Now, if they're killed off and we get less and less of them, that means we get less and less feedback. That's why people with neuropathy eventually get balance problems. They fall, they need a cane, they need a walker. Okay. Now, your question will be, who's killing those small diameter nerve fibers? Who's
yes,
killing those, right?
yes,
Well, most people know one cause of neuropathy. It's diabetes, right?
mhm,
Because diabetes is sugar, and sugar is what? A poison. We talked about toxemia in another podcast. Toxemia is all the toxins that we are exposed to or ingest, and they cause an inflammatory process in the body, and they cause free radical damage, right?
mhm,
So diabetes, sugar as a toxin basically attacks the nerve fibers. But most people are diagnosed with what we call idiopathic neuropathy. It's a fancy word for doctors or science to admit that they don't know what the cause is. Cause is unknown. But a little bit of research and common sense tells us that the cause are toxins. So we have two good examples to illustrate that. Number one, cancer survivors often end up with neuropathy. Why? Because they had chemotherapy. And what is chemotherapy? Nothing but toxins. So the chemo killed the small diameter nerve fibers, resulting in neuropathy. Another group that we can look at is our veterans, because they were exposed to Agent Orange. And so many of them have neuropathy, okay, because the toxins attacked the small nerve fibers. Okay, so in order to fix this, Sean, we really need to do two things. We need to restore the vascularization or the blood flow in that area, because
mhm,
many of those people, the vascularization is attacked. The small nerve fibers don't get the nutrition, don't get the oxygen. Sure, they're killed off because the toxins there's no nutrition, there's no oxygen. So we need to restore the circulation. And as soon as the circulation restores, the small diameter nerve fibers can regenerate. And so with stem cell injections, we have witnessed over and over again, even objectively, because we can take a tissue biopsy and look at the vascularization of a tissue, and then 6, 9, and 12 months later, take the same biopsy, and we can see a normal vascularization again. And as soon as we can see that, the small nerve fibers suddenly come back, and the patient loses the numbness or the pain or the burning, but at the same time they can throw their canes and walkers to the curb, and we've seen that many times. Now, the only thing that I want to finish up with on neuropathy is that why do they attack the small nerve fibers, these toxins? Well, our spinal cord is an extension of our brain, and so at each level nerves come out to supply that area. but in our brain and in our trunk, those nerves are protected by a myelin sheath. It's like a wire that's insulated.
Mm-hmm.
And so these toxins cannot attack the rest of our body. But our extremities, the small diameter nerve fibers, they don't have that myelin sheath. They're not protected. And that's where these toxins attack. And that's why we end up with neuropathy in our extremities and not in the rest of our body, because those large diameter nerve fibers have that myelin sheath that protects them.
Got it. So, so you said sugar plays a role as a toxic material. For people that are feeling the onset of neuropathy or have neuropathy, how much of a role is that playing? Is cutting back and being conscious on your sugar intake, is that, once it's set in, is that going to have any effect on getting you like back to restoring those? Or
well, think about type 1 and type 2 diabetes, right? Everybody agrees, even though that's not what's happening, that type 2 diabetes can be 100% controlled with diet, right? But they'd rather take the medicine than adjust their diet. But even conventional medicine agrees that it could be controlled completely with diet. But I would say, Sean, again, is look at the bigger picture of toxemia. So yes, cutting your sugar will help, but there's another hundreds of things that we can do to reduce toxemia in our body, right? So we need to get man-made foods and drinks are loaded with artificial colorings and sweeteners. And our drinks too, you know, there's no nutrient value to it. It's all chemical toxins. Our electromagnetic radiation, our air, our water, it's all polluted. The chlorine from our chlorine fumes from our shower, the exhaust gas from cars, there's a constant onslaught of toxins to our body, right? So whatever we can mitigate and minimize, we have to do, and it will help us to keep toxemia in check. And if we can keep toxemia in check or under control, we keep systemic inflammation under control. And even according to conventional medicine, systemic inflammation is responsible for over 90% of all disease. So that's why, to me, health is easy on a theoretical level, because all we need to do is keep toxemia in check, make sure we reduce the exposure and intake of toxins, and simultaneously increase the intake of nutrients and supplements, for example, that combat free radical damage and systemic inflammation. And if we can do that, disease has no place.